Collection of blood. Blood has to be tested in most of the blood-related disorder, the metabolic disorder and various infections. There are two different ways of obtaining the blood, depending upon the volume of blood required for the test. The capillary peripheral blood and venous blood. Capillary blood collections. The capillary blood is obtained by pricking the tip of the finger, lobes or ear from toes, and in infants. Capillary blood is obtained by pricking the tip of the finger, lobe of ear from the toe, and in infants it is obtained from the heel. However, the most convenient place to prick is finger. It is to be pricked from about half centimeter from the nail. It is to be pricked from 3 millimeter depth. The area to be punctured should not be cold. If it is cold, warm it by massage. Disinfect the site of puncture by using a spirit or 95% alcohol. Wipe off the first drop of the blood and use the next drop for testing. After obtaining the sufficient amount of blood, let the patient apply slight pressure by using the spirit with a sterile swab. This way of blood can be used when the amount of the blood requires is only few drops, like a HB, TLC, DLC. For capillary puncture, sterile needle or a sterile lancet should be used. Generally nowadays disposable needles are used. If reusable needles are used, it should be sterile one. Venous puncture. When large quantities of blood is required, it is obtained from the vein. Generally, the vein of arm is used. There are 5 veins passes through arm. They are cephalic vein, basilic vein, accessory cephalic vein, median vein, and anterior ulnar vein. Any prominent vein is used for collection of blood. In some cases, a vein from the wrist part or leg can be used, but it should be prominent. Collection purpose. First of all, assemble all necessary equipment such as needle, syringe, tourniquet, disinfectant, cotton swab, tray of water, collection bottles. Needle. The sterile sharp needle of bore size 18 to 20 gauge, medium 1.2 to 0.9 millimeter for adult, and 23 gauge 0.5 millimeter for children are needed. The length should be medium, about 20 millimeter for adult, and short, about 15 millimeter for children are used. Generally, disposable needle are recommended. If reusable needle are used, it should be sterile properly. Syringe of different capacity, like 2 ml, 5 ml, 10 ml, 20 ml are available. The size of the syringe should be selected on the basis of a amount of blood required for testing. Generally, disposable syringe are used. If reusable syringe are used, it should be washed immediately and then sterile before using. Tourniquet. They must be soft rubber tube or belt. It is applied to arm about 3 inches above the elbow. It helps to slow the blood flow and make the vein more prominent so that the puncture site is selected. Disinfectant. To clean and disinfect the site of puncture, disinfectant is used. It may be spirit or alcohol. Cotton swab is used to apply disinfectant. Water bath or water tray. Water tray should be used in case if reusable syringe are used. If any small amount of blood is present inside the syringe, after pouring in a container, the blood will be dried and clotted. This will difficult in cleaning and the movement of the piston to reuse. Therefore, water tray is used for rinsing the syringe immediately. Collection bottle. The bottle should be sterile with the cap. If anticoagulant is required, it should be added within the bottle in proper amount before blood collection. The bottle should be labeled for patient identification. Procedure. First of all, decide the amount of the blood required and select the container according to the test to be done. Now ensure the patient what is to be done. Lay the arm of the patient on the table. Apply the tourniquet and select the prominent vein of the patient. With this cotton swab, disinfect the puncture site. The cotton swab should be previously soaked in the disinfectant. Assemble needle and syringe. Check that it is sharp and unblocked and it is moving smoothly. Passing air through the syringe can do this, but there should not be any air present in the syringe at the time of blood collections. With the left hand, hold the patient arm so that the skin over vein is tightened. Ask the patient to open and close the wrist. Take the syringe in the right hand, holding index finger against the base of the needle. Keep the point of the needle to upper side and push firmly and steadily without any hesitation into the center of the vein. Angle between the skin and needle should not be more than 30 to 40 degrees. The movement the moment needle enters the vein, blood flows back into the syringe. With your left hand, slightly pull back the piston till requires amount of the blood is obtained in the syringe. Now remove the tourniquet, place cotton swab over the needle and wound. Withdraw the needle slowly and ask the patient to place a cotton swab over the wound. This stops bleeding from the wound. Remove the needle from the syringe and gently expel the blood into appropriate container. If anticoagulant is used, gently shake the bottle for proper mixing. If reusable syringe is used, immediately wash the needle with water using the water tray.